Hi friends, how are you? Welcome to my YouTube channel. I'm so glad to release my first video on pathology. Let's start the series from gastrointestinal system. This video is about on esophageal disorders part 1. Can you do one favor for me? If you are not subscribed my channel, kindly subscribe, turn on notification bell so you can keep watching all my medical videos for free. Shall we start? Esophageal disorders. In this video, what are the contents we are covering? I will give little brief explanation about esophagus, where it is located, how many layers it have, and little physiological function. Then after we are studying here pathological disorders. What are the disorders we are covering? First one, tracheoesophageal fistula, esophageal web, Zenker diverticulum, Mallory Weiss syndrome, esophageal varices, and Achalasia. If you see this picture, in this picture you are seeing one tube-like structure. This tube we call esophagus. Esophagus is a fibromuscular tube. If you see that length of that esophagus, it will be 25 centimeters. It originates from the inferior border of the cricoid cartilage. It will be in C6 level and it extends to the cardiac orifice of the stomach. It's in a T11 level. If you see the main function of esophagus, that esophagus will help for passing food from pharynx to stomach. In gastrointestinal system, only esophagus is the narrowest region of the alimentary tract, except vermiform appendix. If you see this image, in this image, in 15 centimeters, you will get upper esophageal sphincter in this area. This is upper esophageal sphincter because if you see this image, in this 15 centimeters area, you will get upper esophageal sphincter. The esophagus have two types of sphincters. One is upper esophageal sphincter and lower esophageal sphincter. In this 15 centimeters, you will get upper esophageal sphincter. This upper esophageal sphincter is voluntary condition and it's made by striated muscles. It's present at cricopharyngeus area. Then after, in 25 centimeters, you will get arch of aorta. Then after, in 27 centimeters, you will get left main bronchus. In 40 centimeters, at T11 level, you will get diaphragm. In the diaphragm, we call cardiac orifice. In that area, you will get lower esophageal sphincter. This lower esophageal sphincter will be in physiological condition. It is involuntary condition. Right? If you see this image, you can appreciate this image. This area we call pharynx. In this pharynx is divided into three parts. First one, nasopharynx, oropharynx, and laryngopharynx. If you see here, this area is called posterior to the nose. You call this is the nasopharynx. If you come down after soft palate, if you see this place posterior to the mouth, we call this is oropharynx. If you come to the down to the epiglottis, if you see here posterior to the larynx, you will get laryngopharynx. This nasopharynx and oropharynx between, if one palate is there, we call this is soft palate, and we also call it this is uvula. Then after oropharynx to laryngopharynx, in between one body is there, that body we call epiglottis. Now esophagus, how that blood produced, arterial supply we are seeing here. The esophagus will get blood from branch of aorta and inferior thyroid artery will provide blood to the esophagus. For drainage, inferior thyroid of veins and azygous veins will drainage the blood from esophagus. If you see the innervation, in innervation for the parasympathetic you will see vagal trunk. In sympathetic nervous system you will see cervical and thoracic nerves. Now, histology of esophagus. If I cut esophagus, I can observe 4 types of layers present in esophagus. This is mucosa, submucosa, muscular propria and adventitia. In mucosa, it's made by non-keratinized stratified squamous epithelium. If you see the submucosal layer, you will get some blood vessels, lymphatic vessels, little glands and plexus will be there. In muscular layer, you will get 2 types of layers. One is circular layer and longitudinal layer. This circular layer will help for narrowing the esophagus. If you see the longitudinal muscle, it will like compulse and stretch will be done. If this both will work together, we call it is a rhythmic contraction. That rhythmic contraction we call peristalsis. In this esophagus, as I told you before, it's divided into 3 parts. First one, superior third, it's made by voluntary muscles, voluntary striated muscles. Middle third is formed by voluntary and smooth muscle. Inferior third part will formed by smooth muscles. Innervation of this esophagus layers, that submucosal layer and circular layer, in between one plexus is there, that plexus we call submucosal plexus or Meissner plexus. Circular and longitudinal layers, in between one plexus is there, that plexus we call myenteric or Auber plexus. Now we are saying swallowing process. If we see this guy, this handsome guy, he eating some pizza. He chewed that pizza slice and it's mixed with saliva and it formed like bolus. Then after that bolus coming to down part. If you see this second image, that bolus coming to the oropharyngeal space, in that space one soft palate is there, that uvula will be elevate upward. Why? If that uvula is not elevate, what will happen? That food will goes to the nasopharynx area. That's why that uvula will elevate. In third picture, that food passing to the oropharynx to laryngopharynx. If you see this laryngopharynx, you will get one body. This body we call epiglottis. This epiglottis will covers the trachea area. Why? If that epiglottis is not covered, what will happen? That food will enters to the trachea. If in trachea, like water or food materials, if enters into the trachea, means we will get aspiration pathological condition. This aspiration means some material accumulated in trachea. So this epiglottis will cover the trachea area. Then after what will happen? Here, as I told you before, in C6 level you will get upper esophageal sphincter. When food passing, that time upper esophageal sphincter will be relaxes. Because of that relaxation, that food passing to the esophagus. In that esophagus, peristalsis movement will be there. Because of that peristalsis movement, that food will went to the stomach. This is the process of the esophagus. Now we are going to see the pathological conditions. First one, tracheoesophageal fistula. This is the congenital defect, malformation of trachea and esophagus. Congenital defect resulting in a connection between the esophagus and trachea. Here, if you see this picture, this is the normal anatomy of trachea and esophagus. In tracheoesophageal fistula, what will happen? Some esophageal atresia will forms. Because of esophageal atresia, esophageal atresia means we call it will be like narrowing. Because of narrowing, if we giving any food to the baby, that baby will automatically vomit. So in this first part, you are seeing pure esophageal atresia. In second point, you are seeing here pure tracheoesophageal fistula. This will be in HC. In this defect, what will happen? After food passing to the esophagus, that food will enter to the trachea. Because of this malformation, you will get aspiration problem. Next, this is the most common. If you go to hospital, you will get this type of 85% of this type of disease you will get. This esophageal atresia with distal tracheoesophageal fistula. In this disorder, what will happen? This esophagus part didn't attach with trachea. So that's why that food will comes here and automatically that baby will vomit. What are the signs and symptoms you will see in this disorder? Vomiting, polyhydramnios, and abdominal distension and aspiration you will see in this tracheoesophageal fistula. Next, esophageal web. In esophageal web, what will happen? One mucosal layer will form in that esophagus area. If you see this picture, you can appreciate here one mucosal layer forms. This mucosal layer we call thin protrusions of mucosa. This is idiopathic, unknown cause. It will forms. It is mainly you will see in women older than age 40 years old. In this disorder, you will observe dysphagia and poorly chewed food. If any person is eating food with poorly chewed, then what will happen? In this area, that food will be stuck. Because of that food is not going to down. That's why that patient feels difficult in swallowing. In this esophageal web, you can observe after it will develop squamous cell carcinoma. What are the clinical features we will see in esophageal web? Patterson-Brown killing. It's also known as Plum-Wilson syndrome. This Plum-Wilson syndrome, you will get dysphagia, iron deficiency of anemia, esophageal web, beefy red tongue because of iron deficiency, and atrophic glossitis. Glossitis means inflammation of tongue. Then after chiliosis. If you see this picture, this is the chylosis, because in lips surroundings some rupture will forms and it will like painful sensation will be there. This is the beefy red tongue, right? For esophageal web, what are the treatment is there? In treatment, they will give endoscopy dilation. Next, Zenker diverticulum. If you see Zenker diverticulum means out pouch is forms. That out pouch we will call false diverticulum. Actually, diverticulum is divided into two parts: true diverticulum and false diverticulum. In true diverticulum, you will get 4 layers like mucosa, submucosa, muscular layer, and adventitia. In false diverticulum, you will get only mucosa and submucosal layer. In Zenker diverticulum, you will get in pharyngeoesophageal muscle, you will get false diverticulum. This Zenker diverticulum most commonly affected by elderly males. If you see this picture, here you can observe thyropharyngeus muscle will be there and cricopharyngeus muscle will be there. In superior part, thyropharyngeus will be in oblique muscle layer, and in cricopharyngeus muscle you will get transverse layer. In middle you will get one Killian triangle. This Killian triangle will be like thin. Because of that problem, what will happen? One pouch will forms. That pouch we call Zenker diverticulum, right? Because of this this pouch, it presses that esophagus part. Because of what will happen, dysphagia will happen, and obstruction and gurgling, aspiration and foul breath will occur in Zenker diverticulum. Foul breath is also called bad breath or halitosis, and many names are there. Next, neck mass also we can see in this Zenker diverticulum. We will give barium to swallow. After we will take imaging, you will get this type of picture. In this picture, you will see here, this is the diverticulum. For the treatment, we will do removal of diverticulum. After this diverticulum, they remove that pouch and they will close with stitches. This is the Zenker diverticulum. Next, we are going to see Mallory-Weiss syndrome. In Mallory-Weiss syndrome, longitudinal laceration will forms in distal part of esophagus. Where it is located? At gastroesophageal junction it's located. In this part you will get tears will be have in this part. This is we call Mallory-Weiss syndrome. In this Mallory-Weiss syndrome you will have like severe vomiting and more amount of alcoholism and bulimia, more amount of eating. These people have this type of disorder. It is very painful and hematemesis. Hematemesis means vomiting with blood. Next, this is the risk of Bauer-Have syndrome. If you see this image, you will get esophagus and stomach attached. Here, because of this type of laceration, what will happen? One rupture will be there. Because of that rupture, one hole will forms from that hole. That air will going to the mediastinum part. That's why if you see in imaging, you will get this type of picture. Here in mediastinum area, you will get air, right? This is the Mallory-Weiss syndrome. Next, we are going to see the esophageal varices. In esophageal varices, in distal part, that blood vessels will be dilated. Where it is present in submucosal, blood vessels will be dilated. If you see this picture, this type of dilation of blood vessels will be happen. Normally, this esophageal blood will drainage into the portal vein. But here what will happen, because of portal hypertension, that blood will goes backward to the esophageal part. That's why this esophagus blood vessels will be dilated. In this esophagus varices, you will get painful hematemesis because after dilation, that blood vessels will be ruptured and that blood will goes to the stomach area. In that time, because of that irritation, you will get vomiting. In that vomiting, you will have that blood. That's why we call this is painful hematemesis. Most common death in cirrhosis. If patient have a liver cirrhosis, means that patient will get this esophageal varices. Next, we are going to see the achalasia. If you see this achalasia, this is a disordered esophageal motility with inability to relax the lower esophageal sphincter. In achalasia, what will happen? That distal esophageal sphincter will be constricts, it incompletely relaxes. Why this achalasia will happen? Two types of problems will be there. Because of mesenteric plexus, damage of ganglion, this is the idiopathic, we will call this is primary cause. And secondary cause, it will damage mesenteric plexus because of Trypanosoma cruzi infection. We will study in Chagas disease. In achalasia, we will get one triad. In triad, what will happen? First one, incomplete of lower esophageal relaxation will be occur. Then after increase, lower esophageal sphincter tone will be formed. Then after aperistalsis, that peristalsis is absent. Next, clinical features: dysphagia, difficulty in swallowing, difficulty in belching, and chest pain. Same to some like this in achalasia patient, they will feel like some heart attack type feeling they will get. And high lower esophageal sphincter pressure on esophageal manometry. If you see the imaging of achalasia, you will get bird beak type of structure. And because of this achalasia, it causes risk of esophageal cancer or small cell carcinoma. If you see here this image, here achalasia of esophagus will be there. In this distal part of esophagus, what will happen? That esophagus are narrowed. Because of this problem, that food is not going to the stomach. If you see the imaging, you will get this type of picture, bird beak picture, bird's beak structure. And what are the treatment? We will give calcium channel blockers and nitrates for dilation. Thank you for giving this opportunity. If you like this video, kindly subscribe. We will study other disorders in the upcoming videos. Thank you.